Hello, 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 everyone. Hello, it is Dr. Brandy B. Come on in, come on in. I am late, but come on in. This is going to be a good one. I'm going to talk about all the things that you wanted to know about mental health that you may not have even known that you wanted to know. I want to tell you about them. So come on in and let's talk about it. I am way late today, guys. I had a coughing spell that I could not stop. It's a horrible time for asthma, and so I've been having some challenges whenever I go out into the elements. But I am here with you today, so come on in. Let's talk about Mental Health Awareness Month. So I'm not in my usual yellow or yellow and blue. I'm wearing green because green is the month that has been delegated. As the Mental Health Awareness Month, green. So we do that in May every year, and I want to talk about some things that are mental health related. Hello, Miss Irene Robinson. Hello, thank you, and welcome. If you know somebody, I take so much albuterol, y'all, my hands are shaking. If you all know somebody who needs to be here to just learn about what mental health is and isn't, and what mental illness is and isn't, then go ahead and grab them. Let's come in. Let's talk about it. Let's talk about it. I'm so excited to have you all here. Go ahead. Let me see if I can share the link. I don't know that I can do that, but we will go ahead and see if anyone else will come in. So glad to see you all. I see that 2 people are here. So thank you all so much for watching. If you want to share the video, let somebody else know that we are here. That will be great. All right, that muted myself. I don't want to do that. Let's see. I don't know that we can share this video. But anyway, I will go ahead and just get started. I'll go ahead and just get started. So I'm Dr. Brandy B, your triple board certified pediatrician, adult psychiatrist, and child and adolescent psychiatrist. And through my Facebook live stream, Focus on It Friday, where I bring you cutting edge and up-to-date information about mental health topics. And I do this usually on Fridays at noon, but sometimes we run a little bit late. So we get over here whenever we can to give you some good information. Hello, my cousin Karen Denise Jackson, all the way from Albany, Georgia. Thank you so much for coming onto the show at this late hour. So let's go ahead and get started. You hear a lot of talk these days about mental health. And so I wanted to first talk to you about what mental health is. Mental health is the emotional, psychological, and social well-being that a person has. So emotional, psychological, and social well-being. And how do we do this? Or how do we know? We know that a person is healthy based on their actions, their behaviors, and their feelings. Actions, behaviors, and feelings. So your mental health is a state of emotional, psychological, and social well-being. And we judge that based off how a person acts, thinks, and feels. And so when we have someone who is not mentally well, they may have behaviors, actions, or feelings, or even thoughts that are not those that we would think of as being healthy or based on good decision making, if you will. The book that we use, our DSM, lists all of the varying numbers of mental illnesses, because the opposite of health is illness. And so our DSM talks about mental illness. And so what are some examples of mental illness? Those can be things. Hello there, Miss Ray. Hello. Mental illnesses can be characterized by mood disorders. So like depression and bipolar. Mental illness can be characterized by anxiety disorders. So either generalized anxiety disorder, where you worry about all things all the time, or a specific phobia, which might be where you're afraid of heights, or you're afraid of a certain animal, or you're afraid of even being outside, okay? That would be an anxiety disorder. Your personality disorders, right? So everybody has a personality type, but there are some types of personalities that we think of as being comprised of unhealthy coping skills or unhealthy behaviors. And so we would call those personality disorders. Other types of mental illnesses could be eating disorders. Bulimia is one. Anorexia is one. You may even look at your note and see that anorexia can be just the loss of appetite. But anorexia nervosa is actually the medical term, the psychiatric terminology, where there is not only weight loss, but distortions, or a person thinking of the way that they look as not being, what it actually is. And so we would say that that person may have anorexia nervosa. All right, so you got your mood disorders, you've got your anxiety disorders, you've got personality disorders, you've got eating disorders. I missed psychotic disorders. Your psychotic disorders are comprised of disorders that have to do with people who do not think of things that are in a reality-based fashion. So hallucinations are very common in psychotic disorders, and delusions are very common in psychotic disorders. So hallucinations could be hearing things that aren't there, seeing things that aren't there, tasting things that aren't there, and feeling things that aren't there. Any of those can be forms of hallucinations. Delusions are fixed statements or ideas that a person has that are not based in reality. So for example, thinking that your wife is trying to poison you, right? Could be paranoia, could be just a delusion. And then, so one of the things that we have to ask is, do other people in a culture? So this is why things like culture can be so very important in our field as mental health providers. Because if this is something that is culturally based, it could be something that is accepted in that culture and not necessarily anything that bothers anybody. Or it could be something where the whole culture believes something that is not true. And so that would be something else that you might have to deal with. Some of your common psychotic disorders could include schizophrenia. That is probably the one that most people know about, schizophrenia. But I do want you to be aware that mood disorders like bipolar disorder and even depression, right, can have psychosis as a feature. So hearing things, seeing things that are not there. Trauma-related illnesses. So PTSD, for example. So a person who has had a trauma and then in some way re-experiences that trauma. So whether it be through nightmares or through flashbacks, they re-experience it. And then they have other symptoms like avoiding things that remind them of the trauma. So where it happened, the person that did it, anything that reminds them of them, the scent that they were wearing, the way that they look, their height, their race, or anything, like that. Those could all be things that would remind them. And so they would avoid those things. They would avoid thinking about it. They may block out certain aspects of the trauma. And so they'll say, I can remember up until a certain point, and then I can remember what happened after that, but I can't remember what happened in between. And so you're avoiding things. So the 3 parts of PTSD, you have to have a trauma. And keep in mind that the trauma can be experienced by the person personally. So they were beaten, they were emotionally abused, they were neglected. And of course, neglect is the most common type of trauma. So any of those things, they were physically, sexually, verbally abused. Personally, that's one way. You could also be traumatized by things that are happening around you, right? So during the pandemic, during all of the racial uprisings and such, we watched that stuff on the news. It was on the news nonstop. And so you can see traumatic things on the news. When planes are running into buildings and we watch it over and over and over again, that can be traumatic, even though it's many states over, time zones away. It can still be traumatic to us. So you do not have to even know the people that a trauma happens to in order for it to be traumatic for you. So there has to be a trauma. You have to re-experience it. Flashbacks, nightmares. You have to have some avoidance, either avoiding talking about it, avoiding people, places, or things that remind you of it, avoiding thinking about it. And then Lastly, you have to have a sense of hyperarousal. Oftentimes, people who have PTSD can't sleep. And of course, you can imagine if you're having nightmares, they're going to wake you up. And these are really vivid nightmares of that event, oftentimes happening again, either to you and sometimes to someone else. And so a lot of times people will wake up swinging and sweating and looking at out of windows and checking doors to make sure that nothing is going on that would harm them again and make them be unsafe. So those are your trauma-related disorders. Substance abuse disorders. Substance abuse disorders are, again, a form of mental illness. We oftentimes think of them as a choice, right? And so it may be that a person had a choice to ever drink for the first time. How many people have ever drank for the first time? Right? Many people have. I would dare say that most adults over 21 have had at least a sip of something. And so maybe the first time was a choice, but maybe it was not their choice to continue, such that they became addicted to alcohol, right? So we know for a fact that your genetics, your family history plays a large part in especially alcohol abuse, and we extrapolate that that will be the same sort of pattern that will happen in other substances as well, but that has been studied with alcohol. We know that. And so substance abuse is an illness. It is an illness. It is a disease, and we treat it as a disease. It is a disease that has many relapsing and remitting periods. What does that mean? That means that people will get well and then they will relapse. It will be remitted, right? So when people say, they say that their cancer is in remission, right? So you can have your substance abuse in remission, if you will, and then you can relapse. And people will do this many, many, many times before they ultimately seek sobriety that is long term. But it is an illness. And I think it's important that we think of substance abuse as an illness, because it can be very frustrating, and you can just look at somebody and say, why won't you blah, 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 blah. But that's just like saying to somebody's blood pressure, why won't you? Now, true, we have some things that we can do to control our blood pressure and our diabetes, but by and large, these are illnesses that have to be treated. All right, we've got Miss Luella Marbury is here, and we've got Angela Kennedy Turner. Thank you all for joining. Paula Moore, Brandy Churchill, Alexander, Dr. Nadia Richardson, and Miss Lisa Ray. Miss Lisa Ray says, what about like what I go through with a child that brings up people who have passed and thinks that they are still here and talks about them daily? So with children and death, it depends upon the age of the child and also the cognitive ability of the child, their intellectual ability. So death is understood by different age groups to a different extent. And so the younger the child, the more likely they are to not understand that death is final. And so that's why it's very important that we, you know, are careful what we say to kids when we say things like, grandpa's just gone to the store in heaven, because all they might know is that grandpa's gone to the store and they're expecting grandpa to be coming back, right? And so we have to be very careful in that we explain to them as best we can and in such an age appropriate fashion that grandpa has died. I'm a huge believer in using real words. He has died, right? And we will see him again in heaven, if that is what, you know, you believe in your culture. But kids always will talk about him. And, you know, the only thing that I would say is, yes, we love grandpa and I miss him like I know that you do. But I would not get engaged, you know, and I would not have many concerns about that. I would just simply say, yes, we miss him and we know that we'll see him again. And I know he would love to know you right now and to see all the wonderful things that you're doing. But I would not necessarily be concerned. You say he talks as if they are still here, and when that happens, you got to challenge that head on. If they say something like, well, grandpa told me, well, did he, you know, tell you that in a dream? Or, you know, it's okay to have visions of grandpa as long as he's not telling you to do things that you shouldn't do, or as long as he's not telling you to come and join him, then it's okay for grandpa to come back and to speak to you, and to tell you, good boy, I'm proud of you, and that kind of thing. But if he says grandpa's in that chair, then you want to challenge that and say, we know that grandpa is dead and he is not in that chair. But if you continue to see him, make sure you let me know. And that may be something that you would want to tell the doctor about. All right, good question, good question. So we are talking about mental health, what it is, and then talking about what mental illness is. So mental health is the emotional, psychological, and social well-being, and it affects how we think, how we feel, and how we act. How we think, how we feel, and how we act. And so you can imagine if a person is not thinking in a well fashion, we call them mentally ill. If a person is not behaving in a well fashion, we call them mentally ill. And if a person is not feeling in a well fashion, we call them mentally ill. So mental illness, the term itself has a negative connotation, and people want to talk about all sorts of flowery stuff, right? I guess we do whatever we can to get people treatment. But that is exactly what it is. If my eye is not well, it's ill. If my stomach is not well, it's ill. And if our emotional, psychological, or social well-being is not well, then it is ill. And we call it mental illness. Mental illness can come in the shape of mood disorders. Just a recap, which could be some of the more common ones: depression, and bipolar disorder. Anxiety disorders, which could be generalized anxiety disorder, a specific phobia, a social phobia, personality disorders, some of which include borderline personality disorder, antisocial personality disorder. And antisocial personality has nothing to do with whether or not you like people. It is more to do with, are you anti-societal norms? So like paying your bills, paying your child support, being responsible human beings, not being bullies even in adulthood, not breaking the law repeatedly. That's what we mean from a clinical perspective when we say antisocial. It is, are you antisocial? Are you anti-societal norms? All right, your psychotic disorders, which include, probably most people have heard of schizophrenia. Bipolar disorder, like I said, can be mentioned there. Also depression. You can have a severe major depressive episode with psychotic features, right? Your eating disorders, your trauma-related disorders, your substance abuse disorders, as well as your disorders of childhood. And that's kind of where ADHD falls. And if you think about ADHD affects how a person thinks, how a person feels, and how a person behaves. So it involves all of them, like most of the others do as well. So attention deficit hyperactivity disorder. There's also reactive attachment disorder of childhood. Both of those are typically starred in childhood. You've also got autism spectrum disorder, which most people will identify in childhood as well. I do want to remind you that both autism spectrum disorder as well as attention deficit hyperactivity disorder, these are lifelong disorders. And so regardless of if your child is 8, 18, or 58, you will still notice some impact, right? It may be to a different or varying degree, but you will still notice impact of these disorders even into adulthood. I cannot emphasize that enough. I get a call at least 3 times a week from parents of young adult children or adolescent high school children whose child has decided they do not want treatment for their ADHD, and my heart just cries. I just get so sad because I know that these children who are more than capable to do whatever it is that they want to, college, business owners, heck, President of the United States, if that's what they desire. And I just know that I'll never say what a person won't do or can't do, but I do know that if their ADHD is not treated, it is certainly going to be more difficult. People say What do we need to be treated on the weekends? Well, you're inattentive any day that you wake up. And so just think about your life and what are some things that you are required to focus on. In the mornings, you're required to get up. If you need to make up your bed, that requires focus. If you want to brush your teeth, that requires focus. I've had patients who have counted the bristles in the toothbrush instead of brushing their teeth. I've had kids, writing their name on the mirror instead of brushing their teeth. So that requires you to focus. Being in the shower. I've had kids that'll stay in the shower 30, 40 minutes. And they're wet, but there's been no soap applied. And they're counting the grains of grout between the towel. Putting on your clothes, remembering which goes first, not getting distracted because the TV or the radio or a sibling or a parent is saying something. Not having everything that they need. So they've got one sock, a pair of pants, but no shirt, no undershirt. Or they've got all of that, but no underwear. And then when you send them back to get the underwear, it all goes to smoke because 15 minutes later, they're not back. They've gotten distracted. They were, twiddling with the shag rug on the floor. Who knows? So you needed to get dressed. You need focus to get to cook. How many people have we had that forgot they were cooking? Went and sat down, fell asleep, set the house on fire. You need it when you're driving. You forget to put your signal light on. You run over granny in the right lane and you just got over on a ran her in a ditch and you're like, oh my God, I forgot to let her know I was coming over. Yeah, and you forgot to look too, because if you had looked, you would have seen her. You need your focus to be able to get places on time, to be able to plan out enough time that it's going to take this much time to get dressed, this much time to drive, this much time to pack the car, because packing the car, getting yourself into the car can take anywhere upwards of 5 minutes if you just take yourself out, all the way to 30 minutes or an hour if you're packing a family for vacation and putting luggage in the car and situating it. What else do you need attention for? You need focus to be able to remember to show up at the appointment, not on time, but on the right date. Oftentimes, folks with ADHD will show up on the wrong date. Thankfully, many of the ones I've encountered have shown up a day early. That's good, but can you imagine showing up a day late? Can you imagine showing up for the CEO of a company that you've had all your dreams of getting in front of, and you've prepared for this day your entire life, and then you get there and you don't have the one piece of paper that the CEO was coming to see because you forgot it on your desk, but your desk is at home, not the desk that's at the building. So all of these are things that happen in everyday life. Or how about you forgot it was your anniversary? You forgot to put the mail in the box that your spouse asked you to do. Or you live alone and you just forgot to pay the bills altogether and you come home and you don't have a particular utility on because you forgot to do it, right? And then the hyperactive piece and the impulsive piece, driving fast. A lot of my teenagers have totaled at least one car. Out with the fellas at the lake. That seems like a pretty cool thing to do for adolescents. Except that you forget that, first of all, you shouldn't be drinking. And you certainly should not be drinking around water, but you do that anyway. And then you forget that you don't know how to swim. And then you forget your life jacket. And, oh, by the way, you forgot the car was running. And with the keys in there, it's running. And you locked the car. So now you need somebody to, come and get you. I once had a co-resident who forgot which house was hers and went to the wrong house trying to get in. This can all very much happen. Or, professionals like myself. Not me, but I have colleagues who stay in trouble with the powers that be at hospitals or their clinics because they're so disorganized and they procrastinate so much that they can't get their charting done. And so then they dock your pay, or they will go so far as to take your admitting privileges. So if you can't admit to a hospital, then that hospital can't use you, and so they may as well get rid of you. So ADHD has huge consequences throughout the lifespan of a human being. And I definitely, I couldn't leave here without letting you all know to take care of your kids, yourself, your spouse, or anybody else who has ADHD. So what causes mental illness? Genetics. So you'll often see that if one person has something, many other people in the family will have that same thing, even down to ADHD. I tell you all the time about dads. If you're looking at a child with ADHD, there's a 40% plus chance that the dad has it. There's a 30% chance that the mom has it, right? That's pretty significant. There's also an increased chance that all of that child's siblings will have it. What else can cause mental illness? It can be caused by drug and alcohol. So yes, you have to figure out which came first, the chicken or the egg. Did the drugs and the alcohol come first, or did the mental illness come first? Because drug and alcohol abuse, any substance abuse, is a mental illness, but it can be the result of a mental illness. Case in point, bipolar disorder. When people are manic, they will do things impulsively. Part of that may be using drugs, right? On the one hand, it's because they were just like, oh, sure, I'll do it. On the other hand, it's what people call self-medicate. So a lot of times people have figured out, if I'm depressed, if I'm anxious, if I can't go to sleep, I'll just have a glass of wine. And I'll do that every night. And then I'll need more glasses. And then I'll need the whole box. I had one patient once who was drinking a whole box of wine. I don't drink alcohol, so I was like, oh, Lord, maybe it's like a juice box, apple juice. I found out that a box of wine, honey, it is a different type of juice box, if you will. And so that can be a problem, right? And so it even with ADHD, one of the huge things, oh my God, and I encountered it just this week. He's a young man now that I used to treat. He decided when he went off to college, he didn't want to treat his ADHD anymore. And so I am meeting with another of his relatives, and I asked like I always do, how's my boy doing? And it led into, well, he's doing this, he's smoking this, he's drinking this, he's not in school. And I cringed because this is what happens, right? Dropping out of school, dropping out. So 33% of kids with ADHD, untreated, won't finish high school. 33%, y'all, that's a lot. But even more astounding, 5 to 10%. Only 5 to 10% of those who go to college will actually finish. And so then you get into this self-medicating and really just kind of starts out of impulse. Sure, I'll try it. And then you got a situation. Angela says, I'm glad I caught your live. Girl, I am glad you did too. I am so glad you did. Lisa Ray says, I will be so proud of him. I'm always proud of them. All of my babies, I love all of them. I've got 3 that I've birthed, but I have so many more that I am proud to say I have enjoyed taking care of. Good, bad, or indifferent. Those are my babies, and I claim them all. Thank you for allowing me to care for him and be in you all's life for a long time. A long time at this point. Latina Woods, Dr. Brandy B, hello. Diane and Tina are watching. Hello. Thank you all so much. That's my mama, y'all, and my cousin. All right, so what else causes mental illness? Genetics. If your mom and them got it, you might have it too. Alcohol and drug abuse. It could be the chicken. It could be the egg. You got to really sort it out. Let me just say this. There is a rule in mental illness that you cannot diagnose a person with a mental illness while they are actively under the influence of a substance. So I need for you to be sober for a certain amount of time before I can say that you have whatever your illness is. The reason is because we have a separate class. So you can have a substance intoxication, a substance withdrawal, but you can also have a substance-induced. So you can have a substance-induced depression, a substance-induced mania, a substance-induced psychotic disorder, right? So you could be schizophrenic because it's organic, and that's just how the stars lined up for you. Or you could be psychotic because you had some stuff that was laced with some stuff. And you didn't know it. You thought you were smoking just, and I hate just before marijuana, because it's never just marijuana. But you thought you were smoking just marijuana, and you got something that's got you seeing bears and snakes. And so, ultimately, we're going to treat you the same. But for our record-keeping purposes, is really, and for the family history, it's also very important to know, whoa, JoJo got this after he smoked that stuff that old boy over off Third Way gave him. That was some new stuff he got from over there. That wasn't a regular place. And JoJo has been seeing bears and snakes in his backyard since then. Now, depending upon where he lives, They may be there. But if he lives in the middle of an urban city, he probably does not have a bear in his backyard. Okay? What else? So genetics can cause it. Drug and alcohol can cause it. Other biological issues can cause it. We know that diabetes, people who have diabetes oftentimes are depressed. Now, is that because there's something that changes in them, or is it because, especially with adolescents, the adjustment to the lifestyle change, and it's probably having to do with that. We also know, though, that after a person has a heart attack, there are some things that happen hormonally that can lead to depression. So that is real. That is very much real. Early childhood and trauma in life. I tell people all the time, what happens to you before you are 3 years old is so very important. So on the one hand, nobody ever wants DHR to come and take their kids away, or a family member to take their kids, or whatever else. But if you are a parent and you know that either you cannot provide for your kid, or you know that you do not have your child in the best environments, the best thing you can do for that child between 0 and 3 is to get them somewhere where they can be given the nourishment and the love that they need so that they can thrive. It is between 0 and 3 years old that we learn to depend on other people. We learn to, we talk about people who are anal. The old psychologists of yesteryear, they talked about people being anal retentive. And some people have postulated and said, said that the reason that these people are so anal and want things done a certain way when they want it just so is because between those formative years, 0 and 3, their bodies weren't being changed. They weren't being given food. So they were sitting in poop and pee all day. And so now they, they have issues. They're anal. They want things to be controlled right away. And it dates back to that. If you aren't being fed appropriately, I have families all the time who will say, well, this kid has been in our home. We adopted them and they've been with us for 10 years now, and they still act like we're not going to feed them. They still hoard food, and we find food hidden in the room, and we've told them the refrigerator is open, anything in here you can have. It's because in those formative years, food may not have been available. And so even though they've been in your home for 10 years where food is in surplus, they still just from those years remember what it was like to not have food readily available. And so if you're going to adopt a child, you definitely have to exercise a lot of patience. I think I saw my Auntie Brenda coming in. Thank you for watching if you're here. Leah Whitten says, is there a significant difference between the way women and men experience and or handle ADHD? I've heard before that women tend to have a much broader range of symptoms with ADHD than men. Is that true? Can you give me an example? I think women in general tend to be more organized. And so let me go back even to childhood. Typically with ADHD, even in childhood, why are you giving me an example of what you're mentioning? There are covert or covered or hidden symptoms, and there are overt or obvious symptoms. Girls' symptoms tend to be more covered. They talk a lot. They're chatty Cathys. They may stay out of their seat. They may jump. They may move around, but they are not aggressive. Boys tend to be more overt or obvious. They are out of their seats, moving about all over the place. They'll hit somebody, but it's impulse driven. They're angry. They tantrum. They're super defiant. They're really impulsive. So your girls are sitting there doing their work, but they're talking up a storm. Your boys are flying off the handle. They're hitting people, and you ask them, why'd you hit Johnny? Are you mad at him? Like, Johnny's my best friend. What are you talking about? There sits Johnny with a red cheek because he just slapped him. Something comes over them, they do it. And then they're trying to figure out why other people are looking at them in such a way. So if I had to guess, I would imagine that even in adulthood, the same would hold true. Men are still going to be impulsive, loud, argumentative. The flares of rage that will oftentimes get them diagnosed with bipolar disorder, those can still be there. Whereas women, you know, because of how households usually run, women have to still exercise some control as far as planning, but they may be able to talk their way out of a lot of situations. Still be very likable, right? Still be very likable. Adolescent, young boys with ADHD end up getting labeled as bullies. Girls, chatty Cathys, just because everybody like them because they just talking to everybody. And so, yeah, you can see some of those things continue into adulthood. But let me know, Miss Leah, if that is what you had in mind. All right, so we're talking about what causes it. Genetics, drugs and alcohol, biologic factors, early childhood life, trauma. We've already mentioned trauma. Trauma can have a lasting impact on a person. If you've had any trauma in your life, please seek someone for therapy, not just the pastor, and nothing against pastors. If the pastor knows what he's doing, that's great. But if you've had significant trauma, you need to be engaged in therapy with someone who understands trauma-focused therapy. It is unlike what most people are doing, and you need to have somebody who's experienced with that. And then personality factors can also play a role in mental illness. Personality factors dealing with like low self-esteem. Eventually, low self-esteem can lead to depression and even anxiety. Low self-esteem can be the result of ADHD, which is another reason why I'm so, persistent about people treating it in your very young children, because you'll hear stuff like, I'm dumb, I can't get it right, I can't figure it out, and all that kind of stuff, when really it's just ADHD. So she says, yes, that is basically what I meant. I've heard that boys with ADHD show the hyperactivity much more than girls. Of course, now that you asked for a specific example, I can't think of one, of course, but I'm glad that I was on the right track. And I want everybody to understand that the presentation of ADHD, much like the presentation of all of these diseases, right? Because these are diseases, it varies over time. So in those early years, K1 and 2, hyperactivity, the talkativeness, all of that, they're going to be very prominent, right? And then about 3rd, 4th, and 5th grade, the inattention can be very prominent and can have impact in a very large way on academics. So failure in 3rd grade, that's when we start to see those odd number grades. And if you've been listening to me, you know I talk about that all the time. So that starts in about 3rd grade because the body isn't moving as much, but the brain still is. And those academics are kicking up. And then by 7th grade, parents will bring their kids in, girls with either anxiety or depression. She just stays in her room. And then by 11th grade, full-blown anxiety. Full-blown anxiety. I'm having panic attacks. I don't know if I'm going to make it. And it all boils down to ADHD. And I go back to, especially if it's a girl, what did you get in trouble for in the 3rd grade? And the girl's going to always say, well, I never got in trouble in 3rd grade. And I say, okay, you're right. What did your teacher call your name for in the 3rd grade a lot? Or I'll say, Mom, the teacher said to you all the time, oh, she's a joy to have in class. We love her. We never have to say anything to her. But Mama, she just blank. And it is usually talks too much. All right. Lisa Ray says, we have a great group at Hamilton Children's Center along with you. Thank you, thank you, thank you. They are amazing. And I'm so glad to be a very small part of such a big team. So thank you so much for that compliment. That means a lot. We do the very best that we can. And I must say that everywhere I go, there aren't many slackers. You can't slack and be around me because I'm giving 100% even on my worst days. I'm still, maybe about 99%. But that 1%, everybody's allowed 1%. But we do give our all, and there's a great group of people working there. All right, so that's what causes it. All right, and so the next thing is, how do we treat it? Therapy. Therapy is going to be your mainstay. You can go to therapy like you can go to the Rock. You want some good quality therapy. You want that. Your insurance wants that. The people around you want that. Everybody wants you to be in therapy. And y'all know I say all the time, 100% of human beings need therapy. Why? Because we're traumatized just driving down the street. We're traumatized in our own homes just by all kinds of random things that you may hear or see that people don't even know that it bothered you. But it did. And why did it bother you? It bothered you based on some other stuff that they're not even privy to. You've not even told anybody that somebody spat in your face one time. And while you're chewing, because you got ADHD, and you chew with your mouth open, and some spit flew out and hit them in the face, and now they all spazzed out, and you have no idea what just happened or why. And it was because of somebody spitting on your face 10 years ago. You never told anybody that it bothered you. And that is the situation. So we're traumatized, we have depression, all sorts of things are going on.
All right.
So that can be a problem for you. Hey, get something to pay her for 2 weeks.
Well,
Okay.
Thanks, you got cash?
No. All right, and I'm sorry about that, guys. You can have medicines. You can have medicines that treat you. And of course, that's what I do all day, every day. Medicines are not of the devil. They actually help people. They are actually saving lives. So I strongly encourage you to make sure that if you've been prescribed some, or if your therapy is not helping, or if you have ADHD, then the mainstay of treatment for ADHD is some type of medication. So, plus your therapy combined, you still want to have that as a prime piece. Lifestyle changes, right? So if you're depressed because I have so many families that are living with grandparents, right? So you got a grandparent, a mom, and a child. And the grandparent is old school and mean, racist, homophobic, whatever. And so you got an adolescent child there who's trying to date somebody black and they're gay. And it just does not work out. And the mama's like, but I don't know why my child is depressed. And I'm looking at him like, well, yeah, we got to change the life situation. But it's not always easy to just up and move. You're probably staying with your mom for a good reason. So some lifestyle changes definitely do have to happen. And I can tell you, exercising makes a huge difference. Your diet makes a huge difference. The people that you're around makes a huge difference. One quick question. Why are you telling me this? That can go so far, right? All that drama, all that stress, all that mess. Just ask quick, why are you telling me this? What am I supposed to get from this? And that can go such a long way. And then complementary therapies can be used, like meditation, relaxation, and whatever else it is that you do. If you shop like me, just make sure your bills are paid. Do that responsibly. And that will get you through. Okay. I want you now we're going to do a quiz. I want you to put it in the chat and let me know. I've said this before on the show. What is the most common mental illness in the United States? What is the most common mental illness in the United States? What is the most common mental illness in the United States? Let me see what it is. Is it a mood disorder, an anxiety disorder, a personality disorder, a psychotic disorder, an eating disorder, a trauma-related disorder, a substance abuse disorder, or a disorder of childhood? Is it a mood disorder, anxiety disorder, personality disorder, psychotic disorder, eating disorder, trauma-related disorder, substance abuse disorder, or a disorder of childhood? Go ahead, just type it in the chat. What is the most common type of mental illness in the United States? The most common type of mental illness in the United States. The most common mental illness in the United States. Nobody has any guesses? Oh, Miss Leah says anxiety disorders, but I think you're asking me. Anybody else want to take a stab at it? The most common type of mental illness in the United States. Miss Leah has given her answer. Auntie Bren says disorders of childhood. Anybody else? Mood disorders. Oh man, this is good. Anybody else? Anybody else? Mood disorder, says Miss Brandy. Anybody else? Anybody else? 1, 2, 3, 4. Any more? Can we get 5? One more? All right, well, we'll go ahead and answer. The most common mental illness in the United States is anxiety disorders, right? So people are extremely anxious and they are all around you. They're all around you. Auntie Brenda, a lot of kids, even who have those disorders of childhood, like ADHD, they are extremely anxious. Some of that has to do with performance, because you can imagine that if you've been all your life, you've been told you weren't smart, or if you knew information and you studied and you knew it Monday morning, Tuesday afternoon, Wednesday night, and Thursday night, and you didn't know it Friday morning when it counted for the test, the next week when you're studying, you're going to be super nervous about, am I going to know it Friday morning? Am I going to know it Friday morning? And so anxiety disorders are all around us. And anxiety can present in a number of different ways. It can present even with perfectionists, right? Perfectionism is a form of, in some ways, anxiety, right? I've got to get it right. What if I don't get it right? Leah says, may as well call me Dr. Leah now. That's right, girl. Let's give her badge. I love it. I love it. I love it. Yes. So, and I thought most people would get mood disorders, and we see that we have two there. But yes, it is the anxiety disorder. So the perfectionistic type of person, and I'll do it. The person who believes that nobody else can do it right. That's usually anxiety, releasing that control, right? Miss Cynthia says, my youngest son has so much more confidence since starting treatment for ADHD. Oh, that is amazing. Let me tell you, nothing warms up my heart any better than hearing something like that, because y'all just don't know. I wish y'all could just sit one day, just hang out with me and see the lives that I changed by treating 4 little letters. You would not imagine that something that probably in the 80s and 90s, and people even still think now, oh, it's just ADHD, right? It's not just ADHD, and it is never just marijuana. People's lives are being ruined because they are not treating their ADHD, and people's lives are being saved. And not just the person, the patient, the entire family, right? ADHD and substance use disorders are very much disorders and diseases of entire families and communities. If one child, and think about it, if your child is super hyperactive and disruptive and fighting people on the bus, right? Let's just think about what can happen. You got a kid with ADHD who's beating up kids on the bus. They get put off the bus. Now you got to get them to school. Now they're beating up kids at school, or they're disruptive. They get put out of school. Now you've got to find somewhere to keep them for 3 to 5 days. Or before we even get to that point, they're calling you every day, Miss So-and-so, Miss So-and-so. You got to come get it. You got to come get it. Okay, now you're going to be written up, lose your job, have people, your coworkers looking at you like she always got to leave. Because people are not always as compassionate as we might want them to be, or as the compassion that we show others. And so that can be very problematic. And then you've got even the situation how I came to love and be so curious about ADHD. Parents that were at odds about whether or not a child had it. That child had destroyed my whole office. And the daddy was talking about he's just a little boy. And I'm like, I've been around little boys before, but this right here, something is different here. And I said, I got to check out this ADHD thing, because this right here is something special. So it impacts the entire family, the entire community. And it's about so much more than grades. I can't tell you how many of these smart little chatty Cathys that'll make it all the way to 9th and 11th grade and never make a B until that time. And so their parents are flabbergasted when I tell them ADHD, because it has nothing to do with intellect. It has everything to do about being able to get organized and to produce the answers on paper that we know are up here, but they're so disorganized that they cannot get where they need to be. He started treatment at age 16, delaying treatment due to the lack of knowledge about ADHD by his dad. His dad wanted to blame ADHD, just behavior problems. Absolutely. So you see what I'm saying? And then when you've got a situation like that, if the parents can't come together, then the focus leaves the child and the focus goes on blaming the other parent. And we got to just be cautious about that. All right. Okay, so another question. Y'all like the questions? Okay. So, let me see. Okay. Which substance of abuse is known to have a genetic component? Which substance of abuse is known to have a genetic component? Is it alcohol? Is it marijuana? Is it cocaine? Or is it methamphetamine? Which substance of abuse has a known genetic component? Which substance of abuse has a known genetic component? Alcohol, cocaine, methamphetamine, marijuana. Which substance of abuse has a known genetic component? We'll let one more person answer. Then we'll give you the answer. Correct, alcohol. We know that. We've studied that. And so we know that alcoholism runs in families. We know this. And so what I always tell parents is, kids, just don't drink, right? If you see that in multiple people in your family, then you absolutely want to not even try, okay? All right, let's see what else I got for you. All right, we're taking a walk around the house today and see what else we got. Let's see. Okay, so addiction is an illness or a choice? Addiction is an illness or a choice? Addiction, is it an illness or a choice? Is addiction an illness or is addiction a choice? Is addiction an illness or is addiction a choice? We got 2 for illness, 3 for illness. Either we all right or we all wrong. All right, so addiction is an illness, right? So yes, the person chose maybe the first time to use, but maybe they didn't choose the first time. Maybe they were impulsive because they were manic, or maybe they were impulsive because they have ADHD, and they partook and then they became addicted. So it is 100%, as somebody said, Miss Leah, Dr. Leah said, 100% an illness, and there is treatment, but do be prepared for it to be a long road. Okay, one last thing. Let me see what we got. I thought I had written some stuff down. Okay, one last thing. I'm trying to think of something with ADHD. ADHD, the severity of ADHD symptoms is a, wait a minute, let me get this straight. A student's grades can always be used to, hold on, give me a second. A student who makes honor roll is less likely than a student who does not to have ADHD. A student who makes honor roll is less likely to have ADHD. A student who makes the honor roll is less likely to have ADHD. A student who makes the honor roll is less likely to have ADHD. A student who makes the honor roll is less likely to have ADHD. Absolutely not sure. Not true, I'm sure of it. Not true, says Auntie Brand. Yes, says Miss Cynthia. Dr. Leah says absolutely not true. Miss Brandy says false. All right. So, as I said earlier, your grades and your ADHD status, there's no correlation, right? Now, I will tell you this. The longer a child can go without being diagnosed, or the longer a child can go and keep up their grades without being treated, that usually, but not all the time, is an indicator to me that the child is really gifted, intellectually gifted. They've got a lot of smarts that they can hold on to. But it's only when the work really starts to increase in volume and they start to look to the future. So that's why so many 11th graders come in. The thought of taking an ACT, planning for college, all of that just proves to be too much, and they cannot keep it together. But absolutely not do your grades and your ADHD status, there's no real correlation. I'll tell you where grades really come into place. If a child comes in and they are having failing grades, then I'm more likely to say right away, oh, well, okay. But if a child, once we get the grades where they need to be, I can then use the grades to gauge if medications are working. When medications are working, provided the child can do the work, grades should be great. When the medications are not working, grades may slip off. If a child comes to me and all of life is falling apart except their grades, what I then can monitor based on medications going forward is how easy do those grades come? Because the child who is making, A's, B's, and a C here and there, they may be staying up all night long to get it done. But when we get them focused and organized, and the math folder is actually, I thought something was, one of these kids that put a sticker on my wall. I'm in the kids' room, but that's the sticker next to Miss Leah's name. Once we get the medicines on board and things going well, the grades will, so they still may be making A's, but they can do their homework in 5-10 minutes and go to bed instead of being up all night long trying to get the same amount of work done. So hopefully that makes sense. So I can't really tell you anything about a child's ADHD status just based on grades. So in other words, bad grades may signify that they have it, but good grades do not rule it out. Hopefully that makes sense. So ADHD does not equals ABCD. All right? And Miss Brandy says, ADHD question, how does someone stay organized with ADHD? I have no problem getting organized, but staying organized is almost impossible. So you need some systems in place. It makes sense. Okay, very good. I was trying to Lord, does this make sense? Okay, you need to get some systems in place. For example, in our house, we have the key holder right by the door, right? Still, and my husband has ADHD. He talks about this. Still, his keys end up who knows where. Now, my key, one of my cars is push start. I just leave the key in there. It's in the garage, whatever. My other key, my other car, it stays outside. I walk in with the key in my hand, and I put it right there on that hook as soon as I walk in. So that's how you can always know where your keys are. You really just have to work at it, setting aside some time every day to stay organized. So, I don't know what kind of work you do, but, if it were me, say, for example, if I really wanted to be organized, I would set aside 15 minutes before lunch, 15 minutes at the end of the day. And then, that way you end that half of the day and end the next half of the day being organized. And maybe you can, on the weekends, set aside some time to really do it. Doing time management, setting timers, calendars with reasonable events that you can attend and times that you need to dedicate to it. Those are some ways that you can stay organized. Filing systems, but really just taking the time and saying to yourself, and then getting in the routine. Once you get in the routine of doing something with, if you have ADHD, that routine can continue, but until you stay in that routine, because remember, at rest, the ADHD brain just wants to kind of hang out and veg out and procrastinate. So even getting started can be troublesome. So if it's a huge problem, you may have to, engage in some therapy and even get some medication to help with it. All right. So we were a little bit late today, but hopefully this was good for you all. Make sure you share this with your friends who want to know, oh, okay, well, that's what mental illness is. Mental illness is not a bad term. It just means that, psychologically, things are not well. But we certainly can get them well with therapy, with medication, with lifestyle changes, and then with all the other complementary theories and therapies that we have. I am a huge fan of time alone, doing whatever it is that you like. And here's the deal. As long as it's healthy, not illegal, not immoral, everybody doesn't have to like what you like. That's what makes you unique. So do whatever it is that relaxes you, makes you happy. Some people say, you go on there every Friday still? Yeah, this relaxes me. This is exciting to me. If I can educate one parent or even one child, then it has made the world better, right? It has made the entire world or even that family better. And that's really the goal in what it is that I do. So I want you all to be mental health aware. I'm so glad that you all are here. Please share the video. And then I will see you all next week. So you all have a great week. Do something to make sure you protect your mental health. Saying no is a major thing that you can do, and getting some sleep. Getting some sleep is so important. So getting some sleep and saying no, both of those are very, very, very important. Miss Brady says, thank you so much. Thank you so much for attending. I'm sure that you have something else you could be doing, even if it's just watching grass grow. So I appreciate you coming over here and hanging out with me. Miss Cynthia says, thank you so much for serving us with the abilities God, I think she means God gave. You have made a difference in our family. Oh, thank you so much. Like I said, I really try. And sometimes I say, God, why me? And it's almost like he said, why not? And there's nothing you can say about that. I just go on with it and know that he won't give me anything that he's not really equipped me for. So we'll see you all next Friday. Dr. Leah, I'll be looking for you. Now make sure you see me on noon. I'm going to try to make it on noon today. I got the coughing, y'all. And of all the people that I was talking to when she called me, I got into this coughing spurt with a COVID specialist. And she was like, no, Dr. Brandy, you need to get a COVID test. I said, girl, before I was on the phone with you, I swear I was not coughing. And then it just went on for about an hour. And now it's getting better. If y'all remember, if y'all have been following me for a long time, in October of 2020, I had this cough that wouldn't go away. Turns out I have asthma. And so now it is, I guess it's that time of year. And I'm having a rough bout with coughing at night. And if y'all have kids with asthma, if you have it, you know what I'm talking about. Anyway, I'm going to get out of here. Check out my book if you don't know, because I always get in trouble for not saying I have a book. My book is Shine, Understanding ADHD so Your Child Can Be a Star. You can get it at shineadhdbook.shop. Shineadhdbook.shop. All right, guys, I'll see y'all next time. Thank you so much for being amazing. I'm Dr. Brandy B., your triple board certified pediatrician, adult psychiatrist, and child and adolescent psychiatrist. And through my Facebook live stream, Focus on It Friday, I help parents and educators and anybody who will listen. I help them understand more about mental illness so that they can help those around them live great lives both in and out of the classroom. I love y'all, and I'll see you next week. Be safe. Bye.